Okay, okay, I think it's only fair we just have a run through of what we've discussed. Okay, since we had a very poor network, I think let me just take us back a bit. So, like I said, you're welcome to public health principles. And the reason why we're discussing public health principles because it's one of the pillars of this fellowship. Like we did mention during the final orientation, Community Health Champions Fellowship is anchored on a tripod of public health principles, strategic community engagement, and project management. So, in the course of the life of this fellowship, we are going to delve into each of these pillars as we have started with the public health principles. And it is only fair to begin public health principles by introducing what public health is. The famous definition of public health is the one given by Winslow, which is public health is the science and art of preventing diseases, prolonging life, and promoting health through organized community efforts, and informed choices of societies, organizations, public and private communities, and individuals. Now, you can see there are some components that are quite germane in this definition. We have science as well as an art, preventing of diseases, prolongation of life, promoting health, organized community efforts, and so on and so forth. And like I said, I gave an instance. The reason why public health is very much vital is because it has a whole of society approach, and where I made comparison between public health and clinical practice. In clinical practice, you are very much particular about solving the problems of the patient right before you. But as a public health physician, you go extra mile, you need to understand beyond utility, like the community and so finally, public health focuses on the collective health of populations rather than individuals, and it encompasses a wide range of disciplines and approaches. That is why we say it is multisectoral in nature. Now, these are some of the extracts from Winslow's famous definition of public health. It's a science because it involves both scientific knowledge and it involves practical application, which is based on evidence-based approaches. And it's also an art because it requires a lot of skills, it requires a lot of creative problem-solving skills and what have you. The more you practice public health, the better you become at it. Now, the next component from Winslow's definitions of public health is the prevention of diseases. In fact, this is the primary focus of public health. It should be able to prevent the occurrence and spread of diseases, either communicable or non-communicable diseases. Prolongation of life. It's another extract from Winslow's definition of public health. Public health interventions are aimed at extending life expectancy, and it should be able to improve your overall quality of life by addressing various health determinants. This is a picture of a couple, engaging in a morning exercise, trying to have a better life, okay? This is part of public health intervention. The next is promoting health. It should have this ability to go beyond merely preventing illnesses. Public health endeavors to promote well-being and optimize health outcomes across population. So you can see this is somebody, a lady who is quite very much excited, about her health. It should go beyond preventing illnesses. That is what promoting health is. We'll get to understand that much better as we get along. Another extract from this definition of Winslow's definition of public health, it requires a community effort, organized community effort, as public health initiatives require a well-coordinated actions which are taken usually across multi-sectors, and it involves governmental agencies, healthcare institutions, non-governmental agencies and organizations, religious organizations, private organizations. It requires a lot of organized community efforts. Otherwise, you will not be able to attend to the various challenges that in public health. Coming to informed choices, effective public health practices rely on informed decision-making at both societal and individual levels, empowering communities and individuals to make healthier choices. It's based on an informed choices, of which relied on effective decision making at both society and individual levels. Now, society, organizations, public and private communities. Public health efforts involve collaboration among diverse stakeholders, including governmental, non-governmental, non-profit, and community-based organizations. So you could see, that's why I say it's multi-sectoral in nature. It's multi-sectoral in nature in the sense that the approach of tackling public health challenges is beyond the field of public health. Okay? Individual. Ultimately, public health outcomes are influenced by the actions and behaviors of individuals, highlighting the importance of personal responsibility and community engagement in health promotion. It involves a whole of society approach. It is not just targeted at the individual, it is based on the collective actions taken by the individuals or their behaviors. Okay. Now, coming to the main activities of the day, which is public health principles. The reason why we had to dissect the definition of public health according to Winslow is for us to understand the important components in this definition, because in the course of this fellowship, it's going to play a very important role in the assignment and in subsequent episodes which we shall be having. Okay, like we gave out in the timetable for this week. On Friday, we shall be having another session which is going to be a case studies of malaria from the African perspectives, and we are going to incorporate these principles in solving that particular case study. Okay, so, and that's why it's important we pay attention as we get along. These are the various public health principles. It involves health promotion, prevention, social determinants of health, population focus, equity, interdisciplinary approach, and up to global perspective. We just touch a bit of these principles. These are not the only principles. There are so many. But in the course of this fellowship, we have been able to maintain our focus on this, and I hope we're able to do justice at the end of the day. Now, the importance of public health principles. Public health principles are the foundation of improving and protecting the health of communities and population. That's one. It's community-centered. It's not individual-centered. Public health principles should be community-centered. Okay? And these are principles or policies or interventions which are aimed at addressing health challenges and promoting well-being. It should be based on addressing health challenges and promoting well-being. The third one, by emphasizing prevention, equity, community engagement, public health principles strive to create environment that support healthy living. All these public health principles, the aim of this public health principle is to support healthy living and reduce health disparity between communities or among nations. Public health principles are essential for addressing current health issues, such as infectious diseases, chronic conditions, environmental health hazards, and social determinants of health. Now, it's important we understand the ecological model. The ecological model is a concept of health which provides a framework for understanding the complex interaction between the environment and the individual. Okay? You need to understand the interaction. Man interacts with the environment. Okay, and when there is a distortion in this interaction, that is when we have a disease. I'll set it like that. So it recognizes that health is shaped by factors at multiple levels, including individual behaviors, interpersonal relationship, community characteristics, and societal norms and policies. These are various factors that can shape the health of an individual. It could be based on it could be an individual factor, it could be interpersonal relationship. When we come to the social determinant of health, we have the individual factor. Under the individual factor, that's where you have your age, and that's where you have your what do you call it? Okay, levels of influence. You can see it's further broken into 4: individual level, interpersonal level, community level, and societal level. Each of these levels, they have a way of influencing our health outcome. These levels, the individual level focuses on the behavior and the biological factors, based on your genetics or personal habits. Maybe you smoke, your lifestyle, how how these individual factors influence or affect your health. Okay, that's the individual factor, the kind of choice you make. Okay, to a very large extent, you as the individual, you play an important role in determining your health as much as possible. The interpersonal level, this involves your social networks, your interaction, how your interaction with others influence your health, such as your friends, your families, your peers, or social support. There are people that have been influenced negatively in terms of their health based on social peers, their peer groups. For example, if you belong to a peer group that engage in unprotected sex, most likely you can catch any of these STDs, because of the influence. If you belong to a peer group who believes in the smoking of tobacco, substantially you can end up affecting your lungs, in the course of this lifestyle. Okay, community level. There are some community. How the community. This involves um, the interaction, the individuals who live in the community or work or play in the community, the interaction between these individuals. Community level factors such as social cohesion, neighborhood safety, access to healthy food, availability of recreational facilities, these substantially have a way of influencing your health outcomes and behavior, and also societal level. Okay. Now, I want us to consider this issue. Ideally, this should be a case study which has been broken down that has to do with obesity, based on these levels, the individual level, the interpersonal level, the community level, and societal level. There are some people genetically, they have this gene to be obese naturally. And the individual factor is dietary factors, your choices, the kind of food you eat. If you eat most of these fatty foods, it's expected you're going to get obese as you get along, because your body mass index can begin to shoot up beyond the normal level. And if you involve or engage in sedentary lifestyle, you don't exercise your body, like we saw in the other image, a couple going on a morning workout. All these are individual level. Interpersonal level, your family eating habits. There are some families, they have a very poor eating habit. Maybe they eat all carbohydrates all throughout because of their economic capacity, or because of their financial capability or incapability, or because of peer influence. Societal support for healthy behaviors. There are some society that supports healthy behavior. If you live in a society where you have gym centers around, or you live in a society where you have a chill out center where you can go and relax, if you live in a society where everything is well organized, these are the personal level that can influence the level of obesity. Okay, community level, availability of healthy food choices, access to parks and recreational facilities, neighborhood walkability. All these factors have a way of affecting you by helping you to increase weight or reduce weight, depending on how you're able to make good use of these facilities at different levels. All right. Now, social determinants of health. Anytime you see social determinants of health, we are referring to those conditions that in which people are born, or those conditions in which people grow, live, work, and age, which ultimately can influence health outcomes. And these factors are shaped by the distribution of money, power, resources, and what have you. And as you get along, these are some of the basic examples of social determinants of health. We have the income, education, housing, environment, family, peers, culture, religion. You can, if you want, you can break them into individual factors. Under the individual factor, you can talk about the religion, the age, and what have you, and under the societal factor, you can talk about, the influence of peers, family, and the rest. Okay. So basically, all these things have a way of influencing your health outcome. Somebody who earns, 100, or somebody who earns 1 million on a monthly basis, it is expected that they should have an improved health outcome better than somebody who earns 30,000 naira on a monthly basis. Though it's not always the case, but if you have a higher income, it means you should be able to pay for a better healthcare package for your family. Quite it's expected that you should be able to pay for good education for your kids. It's expected that there is a correlation between education and health outcome. And once you go, you stay in a good environment, you stay in a setup whereby you don't stay in an area that is congested without good drainage systems, with poor housing facility, there is no access to water, no access to food. You stay very close to riverine area, a breathing space for mosquitoes and what have you. You stay in a very dirty environment. Of course, it is expected you come down with cholera, with malaria, with all sorts of diseases that are attached to poor sanitation and hygiene. So, but if you stay in a good environment that is well aerated, with good drainage system, you stay in a house where you don't have holes, standard accommodation, it's expected to improve your health outcome. Environment, the same thing. Family, the kind of family you come from, the kind of peers that you have, as we have explained earlier, there are some cultural beliefs, some cultural norms that we have that can influence our health outcome. In some parts of the world, particularly, they still believe that female genital mutilation, it's important that it's done for the girl child. Some countries, some parts, they still believe this is a norm. And as a result of that, it has a way of influencing the health of the girl child negatively. So this is the cultural background. Religious background too can influence or improve your health outcome. There are some religious beliefs, that are against blood transfusion. No matter how sick you are, it's a crime, it's a sin for you not to take blood and not to give out blood. There are quite a number of religious beliefs that can make you, or once you are sick, instead of you going to the clinic, the next thing you go to a church or you go to a mosque trying to get some healings, when ideally what you need is you need to see a physician. So these are factors that can influence our health outcome. And these are what we call social determinants of health, because they are conditions in which we are born with, or they are conditions that we grow in, live, walk through them, and possibly age with them. Now, health promotion. Health promotion, whenever you hear of health promotion, it's expected to empower individuals and communities to improve their health and well-being. Of course, by adopting healthy behaviors, and this is usually done through making informed decisions and creating supporting environment. It involves efforts to ensure the capacity of individuals and communities to take control of their health. The primary purpose of health promotion, it helps you, it builds your capacity, the capacity of the individuals. It empowers you to take charge of your health. It empowers you to know how to prevent yourselves from diseases and how to promote positive health outcomes. That is what health promotion is all about. Now, these are the strategies for disease prevention. They have been divided into 3, and we'll discuss them one by one. Primary prevention focuses on preventing the onset of diseases or injury before it occurs. So if you hear primary prevention, it's usually before it happens. And this aims to eliminate or reduce the exposure risk factors and promote protective factors to prevent the occurrence of disease. Very good examples of primary prevention is the vaccination that we do, immunization campaigns, which are done to prevent infectious diseases, immunization against polio, immunization against malaria, immunization against COVID. All these are done primarily before the disease occurs, and that is why they are considered as primary prevention. Health education and behavioral change programs promoting healthy lifestyle. The kind of health education you do in order to have a change in terms of lifestyle, or how to promote positive health, positive lifestyle. For example, if you are engaged in say no to tobacco, that's health promotion that you are doing. Say no to sugary substances. That is health promotion, because you are trying to promote a healthy lifestyle and behavior, which ultimately increases the person's health outcome. Environmental intervention to improve health, air quality, and reduce exposure to toxins. If you drive a policy that kicks against air pollution, maybe for those that drive cars that bring out carbon monoxide, you promote a policy that, oh, such cars should be heavily taxed in order to reduce the usage of such cars in our environment. That is an intervention that is aimed at promoting health, ultimately, in the society. So there are quite a number of health promotion strategies that we can use under preventive prevention. These are some of the examples given to you. Quickly, secondary prevention. It's aimed to detect or treat diseases at early stage to prevent progression. This is when you must have been in contact with the disease and you are trying to detect or to diagnose or to understand what the complications are. And this involves screening, early diagnosis, prompt treatment to reduce the impact of disease. For example, if you subject yourself to a screening exercise or to a diagnosis after being infected, or once you are suspected to have been infected, that is secondary prevention. And these examples of secondary prevention includes early detection, when you try to detect some diseases or diabetes, cancer, hypertension, and what have you. Regular body checks, helps in preventing, so I beg your pardon, regular body checks is another secondary prevention, okay? Early detection and treatment. Once you have been diagnosed that, oh, your blood pressure is a bit high, and immediately you are given some antihypertensive to bring it down. That is early intervention, okay, to prevent the progression of disease or minimize complication. Tertiary prevention. Tertiary prevention focuses on reducing the impact of established diseases and disabilities. Underline, established diseases. This is when you try to reduce the impact in order to improve quality of life and prevent the occurrence of such disease. Good examples are given as, rehabilitation programs for individuals recovering from injuries. Somebody who has a fracture, is undergoing tertiary prevention. Anytime you are trying to address that fracture, you are trying to send that person for surgery, these are tertiary prevention, because the person has, you are trying to reduce the impact of the established disease or condition, or disease events. Now, consider the prevention of cardiovascular diseases under these categories of prevention. Like we did for obesity, if you want to reduce or you want to prevent cardiovascular disease, primary prevention, what is expected? Of course, promoting healthy diets. It needs to start from watching out what you eat. You shouldn't be involved in sedentary lifestyle. You should have regular exercises, cease from smoking, to reduce the risk factors such as blood pressure and obesity. Basically, these are some of the risk factors that are responsible for cardiovascular diseases. When you poor dieting, inactivity, once you're not active, smoking, these are risk factors associated with cardiovascular diseases. So by the time you promote healthy lifestyle, by the time you advocate for regular exercises, smoking cessation, you are doing primary prevention. So in the course of your capstone, a lot of you might be involved in primary prevention, where you need to advocate for healthy living, healthy dieting, the importance of regular exercises in our community, as individuals, as members of the family, why we should advocate for, tobacco cessation or sales of tobacco, no to smoking, no to alcoholism, no to alcohol, and so on and so forth. These are risk factors. Why some of you may be focused on secondary prevention, whereby you need to carry out some screening programs for early detection of hypertension. You want to find out the sugar level, followed by lifestyle modification and medication. That is secondary. Tertiary, cardiac, this seems to be a bit specialized, so it's expected that you don't engage yourself in all of these. The focus should be on primary and secondary prevention for the course of this fellowship. If you are set for your capstone, please take note. Now, it's important we understand epidemiology because epidemiology helps us to understand the distribution and determinants of health-related events in a population and the application of this study to control health problems. That's the cornerstone of public health, if you must know, providing crucial insights into the patterns, causes, and risk factors of diseases and injuries in a population. Now, there are some basic epidemiological measures, that we need to get ourselves acquainted to. And we've been able to spell out just three, which is the incidence rate, the prevalence rate, and the mortality rate. Incidence rate, of course, refers to the new cases of a disease case or health condition that occur under a specific period in a defined population. Incident rate refers to the new cases of a disease event in a population at a particular given time. Underline new cases of a disease. Prevalence refers to the total number of existing cases of a disease in a defined population at a given time over a specified period. Mortality, it has to do with death rates. So this refers to the number of deaths occurring in a given population within a specific time period. Please, it's important we understand these three because it will help us a lot in understanding some basic epidemiological models. Okay, so the incidence rate, the first thing that comes to your mind anytime you hear incident is the new cases of a disease, the people newly infected or the people newly affected with a disease in a given population at a given period. For example, if I say incidence rate, the people who had malaria in the month of March, I'm referring to incidence case in a population, in a given population of, say, pregnant women, in a given area, say, maybe in a particular city, say in Kenya, maybe Nairobi, okay? So that's incidence rate because I'm referring to new cases. But if I'm referring to the total number of existing people that have malaria, the total number, regardless of whether it is in March or before March or even December, I'm referring to a prevalence rate. But if I'm talking about the death rate, the people that have died as a result of malaria in a given population, in a given time period, I'm referring to death rate. And these are usually expressed, per 1,000 or per 100, as the case may be. Hope that is clear enough. So the next principles of public health is that of equity. Equity. What do we understand by equity? Equity is the simple definition of equity is fairness. Making sure that those who are truly in need of a particular intervention get the best attention. Those who are in need of drugs should have drugs. The communities that are in need of some basic healthcare services should have it. That is equity. So health equity is the principle that all individuals should have opportunity to attain their highest level of health, regardless of whether they are financially buoyant or not, regardless of whether they live in a city or in a village, regardless of where they are, regardless of their socioeconomic status, regardless of their race, regardless of their ethnicity, gender, sexual orientation, or other social determinants of health. Even if I don't have money, equity says I should have some basic healthcare services that I need to survive as an individual. That is equity. Health equity emphasizes the elimination of health disparities. There is a quite huge disparity between the rich and the poor in terms of health. Health equity says no. Even if you don't have money, you should have access to the basic healthcare services that you need. And that is why you see we have universal health coverage, where we have a lot of insurance. We have, like in Nigeria, we have the basic healthcare provision fund, which offers or cater for the vulnerable group who cannot afford to pay for their health needs. The government step in by coming up with this intervention called the Basic Healthcare Provision Fund to provide a health insurance package that will give you the minimum basic healthcare package that you need at the time you need it for you to survive. Okay? But even though we're still facing quite a number of challenges in terms of full implementation and what have you, but it's a step in the right direction. So health disparities refers to the differences in health outcome or access to healthcare between different population groups, either between the rich and the poor, between the rural dwellers and those in the cities, between the employed and the unemployed, and so on and so forth. Based on the principle of social justice, it says that all individuals should have access to basic minimum healthcare package they need, regardless of their socioeconomic status, regardless of their race, regardless of their ethnicity, regardless of their gender, regardless of their sexual orientation, regardless of their socioeconomic determinants, social determinants of health. Now, what are some of the strategies, that we can use to avert health disparities? And according to the Alma Ata Declaration of 1978, it came to be because there was a huge disparity in terms of healthcare between the developed countries and the developing countries. And that was what brought up the concept of primary healthcare, to provide these essential basic healthcare services that is affordable and that is, acceptable, and which of course should be done through a community participation, and which should be based on the minimum technology that is accepted by the people. Okay, that is the concept of primary healthcare. The concept of primary healthcare came to be as a result of the huge disparity that existed between the developed countries and the developing countries. And this concept was born in the 1978 Alma Ata Declaration, where you have the International Conference on Primary Healthcare in 1978 in Alma Ata. So this is how we can address health disparity. We can address health disparity by addressing the social determinants of health, which involves through policy implementation or through intervention that will improve socioeconomic conditions. If you must increase or enhance the health of the people, it means you should ensure you tackle unemployment in such a way that people are no longer employed, people have sources of livelihood. Either they can employ themselves, you have stable electricity where people can work and provide for themselves. Access to education should be improved. Access to quality housing should be improved. We shouldn't be seeing slums. There should be housing legislation. If you must build your house, you need to ensure you get all the necessary documentation, where how your drainage should be sited, how you should construct your windows, what length should it be, what distance should be from the fence of your building to the wall of the fence. Where should you site your toilet, where should you site your water. All this should be considered or should be done through policy development and implementation. We should have a robust unemployment strategy by government, how to reduce unemployment, healthcare services. So first is by addressing the basic social determinants of health in terms of employability of the individuals, or how people can make or survive, how people can become financially, economically independent, how you can increase access to education to ensure that people get the required education, which is primary to secondary. All citizens must be made to ensure they have this education from primary to secondary school. It should be compulsory. Else, we are going to have a huge disparity, because there is a correlation between your level of education and the level of healthcare outcome that you enjoy. Culturally competent care providing healthcare services that are respectful and responsive to the cultural and linguistic needs of diverse population. Our health, we need to provide healthcare services that do not go against the norms and culture of the people of the society. So if you notice this set of people in the society, they have this culture, you need to see how you can bring your healthcare provision to integrate it into the culture of the people so that the people can accept easily what you are bringing on board, okay? In terms of your advocacy, I could remember a particular campaign that was stalled. This campaign was stalled because the strategy was a wrong strategy. You are promoting a product to a, religious community, a Muslim community that believes so much in good dressing, And when you were promoting something, you brought out a picture of a woman, a pregnant woman that was not wearing anything, just because you wanted to promote how the importance of antenatal, and you have this calendar of a woman without clothes showing her protruding tummy, And because of that act alone, do you know that that particular intervention was rejected by the people of that community? Just because you did not respect the culture of the people, you didn't factor in their religious inclination into your intervention. So as a community health champion, whatever intervention you try to carry out, the first thing you need to do, it has to be culturally competent. You should have a good cultural intelligence. Cultural intelligence that you should be able to respect the culture of the people. You should understand what their needs are and work with it. Community engagement. As a community health champion, we need to understand proper community engagement, because there's the need for proper community engagement is for you to get the buy-in of the members of the community in terms of understanding what their needs are, in terms of how you are going to plan and come up with an intervention. And by the time you have come up with an intervention, what should be the implementation strategy? Because if you get it wrong from the engagement, that people were not properly engaged, whatever plan you make up with at the end of the day to be rejected, you're going to have a problem implementing. But you can imagine, if I want to carry out an intervention in a particular community and I come in and I engage with the people of the community, what are your problems? What are the problems that you're having? We notice that this community, people usually have cholera every now and then. What do you think the problem is? Oh, the reason is because we don't have toilets. A lot of people defecate everywhere. They do open defecation. We don't have access to good water facilities, or it is because we don't even understand what causes cholera. By the time you engage the members of the community, you understand their needs, then you can now begin to say, okay, what do you think some of the solutions are? Well, if we could get access to potable drinking water, it's going to help us. They are the ones suggesting now. And you look at it, if it's something that your budget is within what you can do, or you want to sell another strategy for them, you should be able to sell it. And once they buy it, I can assure you, you're going to have a smooth implementation in the course of that. Policy advocacy. You need to understand, or you should be able to know how to advocate for policies and regulations that promote health equity, address systemic injustice, and reduce barriers to healthcare access. There are quite a number of things that can reduce barrier. So that can be changed through policy formulation or through policy advocacy. Sometimes it could just be a language barrier or a cultural barrier or religious barrier, or sometimes it could be a communication barrier. Maybe you are in a community and you notice that most of the people there don't understand English, and you have a facility where the health professionals don't even understand the language of the community. How do you break this barrier? You need to think out a method. Should you bring an interpreter, or should you train members of the community to be part of the healthcare providers? That's something you need to do through policy advocacy. Data collection and monitoring, that's clear enough. And the strategy for reducing health disparity, like we said earlier in public health, it has to be a whole of society approach. It should be multi-sectoral in nature. The problems in healthcare cannot be tackled through healthcare alone. We need to see how we can incorporate the agricultural sector, because the agricultural sector is responsible for the provision of food security, that we can have adequate amount of food that we need to live a healthy life. If the population don't have healthy food, it means people will die of starvation, malnutrition, which is a serious public health concern. We need food to live a healthy life. So there is a need for collaboration between health and agriculture. There is a need for collaboration between health and education. People need to be educated. People need to understand basic health promotion. You could remember those days in school, we taught how to wash our hands, we taught how to brush our teeth. Some basic things we learned in school. It's important how to wash vegetables, how to do a lot of things. We need that in school. Transportation, there has to be good collaboration between health and transportation. I could remember as a young person in public health, there was a time we were trying to address one of the public health concerns that we were having at that moment, which was road crashes. And I made a presentation and I said, road crashes is a public health concern. And people approached me, why should I term road crashes as a public health concern? That it has nothing to do with public health. But because they understood very little about public health, that was why they were looking at it from that angle. But today, I want you to understand that it is indeed a public health concern, because by the time people are involved in road crashes, what happens? People lose their lives. Their life is no longer prolonged, it's cut short. They could suffer from disability that can take away food from their table and make them to be bedridden in the hospital. You know, it can affect the earnings of the family. If you are the breadwinner of the family and you are engaged in a road crash accident, you know, that can affect your family who depend on you in terms of your income. And once your income is affected, mind you, income is a social determinant of health, right? So even your education can be affected. If you're in the hospital, you know, in sick bed for a very long time, it means you cannot go to school, you cannot go to work, you're in the hospital, you can even lose your job. So it affects other social determinants of health, and by extension, affecting your health, whether we like it or not. Thank you. Finally, we've come to the end of public health policies. If you have any question or any contribution you want to make, please just signify so that we can give you an opportunity to ask your questions or make contributions. You're welcome. So please, let's see your hands up. Who goes first? I wouldn't want to believe I was just talking to myself alone. Frederick, I've seen you. You have the floor. Who is next, please? Freddy, go on.
Yes, thank you very much, sir.
You're welcome.
Yeah, I remain Usman San Omar from Sokoto State of Nigeria. I wanted to ask a question. First of all, I would like to appreciate for a wonderful, educating and exciting knowledge given to us. This is one of the privilege that we have. Thank you very much for that, sir. So I want to ask the difference between health promotion and the health education. Is it in terms of this one containing promoting only, or it contains education in it? So I want to have more clarification on it, sir. Thank you.
Okay, thank you very much. What's your response? Okay, just to further clarify, I want to say this, you know, this is not an academic class. This is more or less like a fellowship class. So, in as much as we will try to welcome questions from different angles, but as much as possible, that questions being asked are centered on the aims and objective of this fellowship. Okay, I'll respond to that. Frederick.
Okay. Good evening, sir. Can you hear
Can hear you. Go on,
me?
please, quickly.
The part you talked about pensions. I was having a code issues, so I don't know if you can just quickly reiterate that part.
Pardon?
When you're talking about the strategies for disease prevention, about tertiary prevention, please can you just recap that area? Thank
Okay, good. Any other one? Unfortunately, Frederick, you didn't tell us where you were joining this from.
you. Okay, I'm joining from Warri, Delta State.
Okay, good. Okay, I cannot find any hands here again. Let me check. Okay, so Osman, let me start with you. We're talking about, you asked the question if there's any difference between health promotion and I think health education, right?
Yes, sir. Yes, sir.
So first of all, anytime you hear health promotion is it's a very broad term, which involves a lot of activities that are aimed at enhancing our overall health and well-being. It includes, like creating supportive environment, advocating for policy changes, how you can change quite a number of things in the community. Then health education, it has a particular focus specifically on providing information on how or teaching individuals or community members about health related events. So health education, once if you're carrying out health education, you are trying to teach the members of the community about malaria prevention, that's health education. So health education can be said to be a component of health promotion. But when you talk about health promotion, anything that you do that can affect the overall health of the individual is health promotion. If you carry out health education, it has the ability to improve the overall health of the individual. That is health promotion. If you engage in policy advocacy, it has the ability to affect the overall health of the population. It's health promotion. So hope that is clear. Right?
Yes, sir. It's clear. I'm with you.
Okay, so to Frederick was talking about tertiary prevention. Okay, tertiary prevention, like we said, it's the prevention that you give to an already established case. Right?